pretty much from the time that I was a kid, I wanted to go into medicine. It wasn't something that was even a question in my mind growing up of what I wanted to do in my life. My grandfather was a big influencing factor. He was a dentist and actually trained here in Philadelphia, and so he sparked the scientific inquiry in my mind, but I always wanted to become a physician. Now, why spine? That's a very different one. So from, once I started medical school, I knew that I wanted to be a surgeon. I knew I wanted to touch. I knew I wanted to be able to influence patients' lives, not just through diagnosis and prescriptions of medicines, but also from performing surgery. And early on, I had experience in orthopedics and neurosurgery and gravitated to spine, that we're able to have such a degree of control over outcomes and over everything involved in taking care of the patient. It wasn't cookie cutter, that spine actually is an art, and spinal deformity in particular is an art, and being able to influence overall alignment was really important to me. For me, the most rewarding part is taking somebody who has terrible pain and terrible quality of life that can't even stand up, and being able to, and even though they may be sick and they may have multiple medical problems, being able to change for the better their lives and really have an influence on the quality of their life from their surgery onward is really rewarding to me. And so spinal deformity, unlike many things in medicine, spinal deformity is tremendously rewarding, and the results are really tangible. The one question that I wish my patients would ask me more is what they and their families can do to ensure that they have the smoothest recovery possible. When a patient comes to our office, they're often in pain and have poor quality of life, and they want to know that what are the things that we are going to be doing as surgeons that are going to help make them better. But in order to really make the recovery process better and to have them have the smoothest recovery possible, having a lot of the social issues taken care of ahead of time can really be beneficial. And so I really wish that patients thought about that a little bit more and could ask me more about what they can do to make it so that their recovery is as smooth as possible. I'm Dr. Joshua Heller. My mission at Jefferson is to improve lives.